Hi, I'm Dr. Craig McFadden. You know, 10 years ago I couldn't have imagined speaking to you today about the incredible strides we've made looking after people diagnosed with cancer in our community. Because 10 years ago, medical diagnoses were often done off-site. Chemotherapy treatments were provided in a dark, windowless ward, and if patients needed radiation, they were sent to London, Hamilton, or Toronto. Having cancer was bad enough. Being treated for it was another adventure. But we've come a long way, and we have so much more to offer. Today we're going to highlight 3 areas in the hospital that have been funded through the Grand River Hospital Foundation with your help. OR6 is different from the other operating rooms in the OR suite in 2 ways. The first is that it's highly electronically integrated, and there are situational cameras both in the overhead lighting and on the walls, and a large screen television monitor in the OR that provides the ability to educate surgeons on new techniques. We can send those images to other hospitals in the province, and it also provides some degree of quality control as we can watch surgeries in process. The second way that it's different is that all of the laparoscopic equipment is concentrated in this OR. There are 3 monitors and equipment that allows us to operate inside the abdomen without making a large incision. Most recently, and with the help of the Grand River Hospital Foundation, we have upgraded our MRI to improve the efficiency with which the magnetic energy can be delivered, and we have improved the software so that we can better interpret the images. We recently have had a substantial improvement in our ability to use MRI in the investigation and treatment of breast cancer because of those 2 improvements. The Waterloo Wellington Breast Assessment Centre is a rapid diagnostic assessment unit. Its aim is to provide as quick a diagnosis for women with breast cancer as possible. Prior to the establishment of the unit, it took approximately 111 days from a woman to move from an abnormal mammogram to surgical intervention. We did not think that was appropriate. At the unit, a woman with a new palpable abnormality or an abnormal mammogram will, on the same day, be interviewed by a navigator, see a surgical oncologist, and have all of their films reviewed by a radiologist. If we believe that woman should have a biopsy, we will do it the same day, and she'll have her results 5 days later. By doing this, we've been able to reduce the time between an abnormal mammogram and surgical intervention to 42 days from the previous 111. With the help of a generous community and your amazing support, cancer services at Grand River Hospital are now amongst the best in Ontario.
It was very important to me to have a cancer center here, so much so that I didn't realize at first. I did have friends before that I helped who had cancer, and I had to drive them to London or to Toronto. Until I had to experience it myself, I never realized how difficult it is driving that period of time between your treatment and going back home. I was so fortunate that I was 10 minutes away, and the services that you get here are top-notch. They're the best you can get in the country. So it made that piece of the treatments that much easier to take.
You have helped us implement new, much-needed programs and services for patients, and have supplied us with the technologies we need to provide the best in cancer care. From all of us at Grand River Hospital, thank you for your generous support and for helping us champion exceptional care with compassion.